Ann and Amy continues next on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560, The Answer.
But now we want to continue a discussion of coronavirus, doing something a little bit different than most of the cable networks that have a disposition antagonist to the administration do. We try to bring on experts who actually know something about what they're talking about rather than politicians to take pot shots at other politicians. So yesterday, Dr. Tony Fauci, who is the CDC's top infectious disease expert, testified before the House Oversight Committee and he was asked, of course, about the lethality of coronavirus. What do we know at this point, even though we continue to have infectious disease experts, all kinds that we've spoken with and that you've probably seen on other shows too, that say we don't have a denominator. We have two problems. One is you can't trust the numbers coming out of China, and that's what Gordon Chang just told us last hour. Number two, we don't have a denominator. So how do you extrapolate lethality rates without a denominator? And Anthony Fauci offered one interpretation of the data such that we have at this point.
Fauci, can you, by way of comparison, briefly explain how does COVID-19 compare to other previous health situations, SARS, H1N1, things like that?
Sure, sir. Thank you for the question. Well, SARS was also a coronavirus in 2002. It infected 8,000 people, and it killed about 775. It had a mortality of about 9 to 10%. So that's only 8,000 people. In about a year, in the 2.5 months that we've had this coronavirus, as you know, we now have multiples of that. So it clearly is not as lethal, and I'll get to the lethality in a moment, but it certainly spreads better. Probably for the practical understanding of the American people, the seasonal flu that we deal with every year has a mortality of 0.1%. The stated mortality overall of this, when you look at all the data, including China, is about 3%. It first started off as 2 and now 3. I think if you count all the cases of minimally symptomatic or asymptomatic infection, that probably brings the mortality rate down to somewhere around 1%, which means it is 10 times more lethal than the seasonal flu. I think that's something that people can get their arms around and understand.
Well, we could get their arms around and understand it, except that the D.C. press corps takes that headline and runs with it to induce hysteria. 10 times more deadly than the flu, killer virus and the chyrons and the music. So even if it was 10 times, you're still talking about 1% of those infected. And frankly, it's a little bit more complicated than that, as Dr. Fauci knows. There was this briefing that was had on Capitol Hill, and some of the notes got around. The things that were included in this briefing of policymakers. 80% of those who contacted, okay, they'll just feel bad,
Right.
get some NyQuil, will be okay. 20% face trouble, but then you have to go through the different age and medical status cohorts. Young children are fine, but can be carriers. This is the briefing. People in their 20s to 40s, fine. In the 50s, 1% mortality. 60s, 1.5% mortality. 70s, 5% mortality. 80s, 15% mortality. And then as we talked about with Gordon Chang, part of this is based on a belief in the numbers coming out of China that half of those who died in China, which represent 75% of all deaths from coronavirus so far, at least as reported, had some underlying condition.
Right, and the average age was 80.
But we can't even believe those numbers, and so we have a little bit of confirmation bias going on in a couple of different directions based on, in part, some people, their disposition towards the Trump administration. And so I don't want to understate it or overstate it. And it just seems that we're in this game of trying to pinpoint the numbers and arguing about, is it 0.2%, is it 1%?
Yeah.
And so
We just don't know at this time.
And I'm not sure what value that has. Why not? We're over extrapolating from limited data, some of which we don't trust. Why not just hold off and focus on the mitigation aspect of it, the containment and mitigation aspects of it, and potentially some of what you're going to do with the to address the economic consequences. For more on the public health issues associated with coronavirus, as we're discussing, we're pleased to be joined again by Dr. Roger Klein. He's an expert with Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, former advisor to the FDA, CDC, CMS, and HHS. Dr. Klein, thanks for joining us again. Appreciate it.
Yeah, hi, Dan. Hi, Amy. Good to be with you.
Good to have you. So what about Dr. Fauci's testimony before that House Oversight Committee yesterday, and this running debate about the lethality rate?
Well, I agree with much of what you're saying, but I would take issue to some extent. Dr. Fauci may be correct, but on the other hand, we do have data now, and there's very good data coming out of Germany, which is doing widespread testing, and they're running a death rate of about 0.15%, which is identical to the flu. I think we need to look at this with a broader perspective. As a person who's run diagnostic labs for nearly 20 years, what we're seeing is ascertainment bias. We're seeing people who are tested who come to medical attention. They're sicker. Where if you test a bunch of dead people, it's going to look like something. It's going to look like the disease kills everybody. So if you test a bunch of sick people, it's going to look like the disease causes a lot of sickness. If you test widely, you're going to get a much more representative picture of what that disease actually is. In Germany, where they developed the WHO test, and they're quite efficient, they have 1,966 cases. So it's not like they have just a handful. They've only had 3 deaths. This is and you have to believe that, first of all, they're getting a more representative sample of the disease in the population, and second, maybe they're isolating people and quarantining them better because of this testing, and that maybe it's also influencing. Maybe the testing's also influencing that death rate. But irrespective, and South Korea has had a death rate that's below 1% as well. So I think we need to, because of widespread testing, I think we need to understand that these numbers are an artifact of who's being tested.
Well, do you think the WHO rushed in declaring this a pandemic?
Well, I think I think what's a pandemic? It means that it's all over the place, and so I don't, right. They're kind of late to the party. It's in 100 countries and it's affecting 100,000 people. This is a semantic game that maybe helps induce panic, but has very little meaning. We know it's all over, and the question is how bad is it? And I've been one who's sort of tried to be objective about this. And you look at it and you say, well, look, either it's pretty readily transmitted and not that dangerous, or it's not that easy to transmit and it's more dangerous. It's or maybe in between. But this is kind of the analysis. It can't be both. You can't have something that's very deadly and very easy to transmit, or everybody would be dead. So you sort of have to.
Pretty logical.
Have to use common sense.
Yeah. What about just going back to the data game again? What about those projections about how many will be infected? The blaring headline on Drudge yesterday was Merkel suggesting 70% of Germans will be infected. There's epidemiologists who are predicting 70 to 110 million Americans will be affected by the time the virus goes around and before there can be, I guess, effective mitigation efforts comprehensively. What about that aspect of it?
Well, now, so some of it depends on how dangerous it is, how lethal it is, or how even the extent of disease. If it causes severe disease in most people who get it, well, of course, you're not going to have that kind of spread because people will be immediately isolated. If it doesn't make people sick, then more people will get it. 40 million people, 5 to 20% of the United States population gets infected with flu every year. If these numbers out of Germany are right, and it's 0.15% identical to the flu in terms of the death rate, well, sure, a lot of people are probably going to get it, and if it hangs around with us, eventually they will. If it leaves, that then it won't happen. But I think the greater question is really what are we dealing with? We need to do more testing here to understand. But I'm very heartened by the German numbers.
And with respect to the response, with the states declaring states of emergency, limiting gatherings to 250 people, suspending basketball seasons, doing events without fans, all of those responses, classes online as opposed to in classrooms, is that all? Have those evasive measures struck you as judicious, generally speaking?
I mean, look, if in fact it turns out to be worse than many of us have suspected, they would turn out to be prudent. If it could. I mean, I think in general we're having an overreaction. I mean, to me, this has looked all along like a flu. Maybe a worse flu, but a flu-like illness, and we've responded in some ways as if it's a life-threatening Ebola, and that isn't the case. I think if it hangs with us, we're going to have vaccines as well, and it may. If it's with us for the long term, it's probably going to end up to be another flu, and if it's not, all the better. Look, people need to take hygienic measures. They need to wash their hands, and they need to use hand sanitizer. They need to not, all these things. Stay away from coughing people. If people are sick, we've walked around too much. People who are sick have gone out and spread it to other people. And the flu kills 60,000 people a year, and we just ignore it. And I think that's the thing that's always been concerning, or has been concerning to me from the start, is that if the response isn't in proportion. If 60,000 people a year die from the flu, and we just shrug it off, why are we panicking about a very small number of people at this point? I think that we need to keep it in perspective. That's really the situation. An elderly person ought to be avoiding crowds because of the flu. Many of the measures that we're taking, the reasonable ones for sure, should have been done a long time ago.
All right. Now, I know if you do get the coronavirus, it's not a death sentence. And we learned last night that Tom Hanks and his wife, Rita Wilson, contracted the coronavirus. They're in Australia, so they're under, getting care. But he has type 2 diabetes. Is that part of the underlying health condition?
I don't. I think it's more people with pulmonary disease and elderly people who can't mount an immune response. I don't. Diabetics are prone to certain types of infections because of high sugar if they're not well controlled. But I don't. My suspicion is, if you don't have underlying medical problems that are a result of the diabetes, I suspect it's not going to make that much difference. We don't really have these kinds of data yet, but that would be my suspicion.
I want to go back to something you said, too, sort of comparing and contrasting how this virus has spread in different locales. Particularly important comparing what you said is happening in Germany and that data to what's happening in Italy, with the president's announcement yesterday, that there'd be a 30-day travel ban to EU, including with respect to goods. Does that strike you as an overreaction? Should we be more surgical in thinking about human interactions, both of a social nature as well as an economic nature? Singapore and South Korea have done one level of containment, and Iran is doing another level of containment, obviously less well. Italy versus Germany, another comparison.
Yeah, so Italy's a great case in point, and it's a contrast to the experience in Germany. And people are really trying to look at these and compare them and try to understand what's going on. I think it's reasonable to, until we have more definitive information about what we're dealing with. I think it's quite reasonable to restrict travel. What I would, the argument that if you look at the German data, there has to be some reason or explanation for why the huge disparity in death rate between Germany and Italy. It could be that Germans they haven't experienced yet because they're testing immediately. that seems unlikely to dramatically increase the rate. What could be going on in Italy is that it's really widespread, and there are lots and lots of people who have it, and they just haven't tested them. And that seems like a very good explanation for at least part of it. There are other things, elderly, maybe they have an older population, and that and are more susceptible, more smokers or something. I mean, there are possible reasons for it, but I read something, and they talk about the Italian culture, and they don't put a lot of space between each other. Different cultures actually stand at different distances, and apparently they greet each other with kisses and that sort of thing. And it's conceivable that there's just a lot of people who are infected there. And if you would test everybody who was infected, you would have a much lower rate.
Yeah, and also, too, I mean, if it stays on the surface for 9 days, it can be transmitted, all those pinky rings that are worn in Italy, too. No, I'm kidding. Dr. Roger Klein, expert with Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, former advisor to the FDA, CDC, CMS, and HHS. In other words, he knows what he's talking about. Dr. Klein, thanks so much for joining us. Appreciate it.
Thank you for having me.
And he joined us on our turnkey.pro answer line.
Hear about the big stories of the day, then talk about them right here on Chicago's Morning Answer on AM 560. The Answer.
The following is a paid political announcement.
Republican business owner and community servant Krishna Bansal is the strong conservative we need in Congress to defeat Bill Foster. He's a Naperville resident with his successful tech business in Aurora. Krishna supports term limits and has pledged to limit his own service to 6 years to lead by example. Key conservative leaders have endorsed Krishna, including Demetra DeMonte, Chris Lausen, Jeannie Ives, Darlene Sanger, Peter Breen, and Alan Skillicorn. Krishna believes in building the border wall, opposing illegal immigration, and bringing